In this lecture, we will talk about the renal blood supply or the blood flow to the kidneys. So the two kidneys basically receive around 22% of the cardiac output or 1100 ml of blood per minute. The heart is basically pumping around 5 liters of blood, around 5 liters per minute. Out of the 5 liters, around 1100 ml of blood per minute is being pumped towards the kidneys. Because the blood flow to the kidneys is very much important. The kidneys have a very much important role in filtering the blood and then removing the waste material from the blood and then basically reabsorbing the blood again into the system. So for this purpose, the renal artery basically enters into the hilum and then it keeps on branching. The renal artery basically divides initially into the interlobar arteries. Basically these interlobar arteries are running between these pyramids. These are pyramids. They are basically made of nephrons. So initially the renal artery is coming, it divides into the interlobar arteries which are running between different pyramids. These interlobar arteries basically branch into these arcuate arteries, and then these arcuate arteries then branch into interlobular arteries. So these are the interlobular arteries. Initially the renal artery, then the interlobar arteries, then the arcuate arteries. These are the arcuate arteries. They are forming arc-shaped structures. And finally, the interlobular arteries. These are the interlobular arteries. The interlobular arteries, these are the interlobular arteries. These interlobular arteries at the level of nephrons branch into afferent arteriole. Now this is a pyramid, and this pyramid is basically made of thousands of nephrons. And here is one nephron. Finally, the renal artery, after branching at the level of interlobular arterioles, becomes the afferent arteriole. This is the afferent arterioles, which basically branch into glomerular capillaries. These are the glomerular capillaries. And these glomerular capillaries or the glomerulus is responsible for filtration of blood in the Bowman's capsule. This is the Bowman's capsule of the nephron. Here the final filtration process occur here at this level in the nephron. And this nephron is basically, this is one nephron taken from this pyramid. These pyramids are, the whole kidneys have around 8 million nephrons, and this is one nephron. So the final branching of the interlobular arteries become the afferent arteriole. The afferent arterioles become glomerulus, which basically is responsible for filtration of blood, and the filtrate basically enters the Bowman capsule and then keeps on moving through these tubules. Now these tubules are basically responsible for taking the waste material through these tubules outside the body, as well as the capillaries which are present around these tubules, which are the peritubular capillaries. They reabsorb some of the nutrients from the tubules. So what happens is that the afferent arterioles becomes the capillaries. These capillaries then make the efferent arteriole, and this is the efferent which is leaving. This efferent arteriole then become peritubular capillaries. So what happens is that there are two capillary beds. One bed is here we have the capillaries. These capillaries then form the efferent arterioles, and the efferent arteriole then form the peritubular capillaries once again. So it is a special structure, because normally once the capillary beds have been formed, it empties into the venous system. But here the glomerular capillaries are making the efferent arteriole, so they are not making the venous system. Here directly they are making another capillary bed, and this capillary bed is basically surrounding the tubules. Now the hydrostatic pressure at the level of glomerulus is around 60 millimeter of mercury. So the pressure of blood, the hydrostatic pressure here is very much high, which is around 60 millimeter of mercury. And with this pressure, the plasma is filtered, and that filtrate basically keep on moving through these tubules, and the nutrients in these tubules are then absorbed in these capillaries, which are making basically the peritubular capillaries. The pressure in these peritubular capillaries is very much low, which is around 13 millimeter of mercury, which is pretty low as compared to the hydrostatic pressure in the afferent arterioles or the glomerular capillaries. So what happens is that due to high pressure, the filtrate enters, the plasma is filtered here, and due to low pressure, the nutrients or these but good substances which are needed in the blood, they get absorbed due to low pressure into these peritubular capillaries. These peritubular capillaries then will make the efferent veins, then the interlobular veins, then the arcuate veins, then the interlobar veins, then the renal vein. So the whole blood supply is such that the renal artery enters the hilum, divides into the interlobar arteries, which is running between two different lobes. Then the interlobar artery divides or branches into the arcuate arteries, which are basically forming different arc-shaped structures. The arcuate arteries divide or branch into interlobular arteries. Interlobular arterioles then make the afferent arteriole. Afferent arteriole basically branch into the glomerular capillaries. The glomerular capillaries then make the efferent arterioles. The efferent arterioles once again make the peritubular capillaries, and then the peritubular capillaries make the peritubular veins, then the interlobular veins, the arcuate veins, the interlobar veins, finally the renal veins, and then enter into the main bloodstream. So that's all about the renal blood supply. But the important thing is that this renal artery and these interlobar arteries, they are basically having different parts. The renal artery has different branches like superior branch, inferior branch, anterior branch. So different interlobar arteries are arising from different branches. Some of the interlobar arteries are arising from the superior branch, which supply the superior lobes. Some of the interlobar arteries are arising from the posterior branch or the inferior branch, which basically supply the inferior lobes. And then the important thing is that there are two capillary beds in the kidneys at the level of nephrons, and one is the glomerulus, which basically is formed after the afferent arterioles, and then after they unite to make the efferent arteriole, this efferent arteriole again divide and make the peritubular capillaries. So there are two capillaries beds, and both the kidneys are receiving around 22% of the blood, which is pretty high, and it makes around 1100 ml per minute. So that's all about the renal blood supply. Thanks a lot for watching the video.